are Stacy, Rachel, and Andina, who's not with us today. We are the community health workers from the Marshallese Women's Association, and we are here with Dr. Suzanne Laurel from Health Point, who will be answering some questions for us about COVID-19.
Yahweh Olive, nga Rachel, yung nga Stacy, ko balagi pen, Antina yomi jagoilo jodenin, kami jele ito kichen, community health worker, jarabali pen Marshallese Women's Association. Ito ko to pachen kachita pen Dr. Susan Laurel, kichen COVID-19.
Yahweh.
Hello.
I'm taking off my mask now.
You would give me Kia.
I'm so glad to be with you today.
And we're so happy to be asking you questions today. And so our first question is, are there long-term effects of COVID-19? And if so, what are they?
Hi, mananain ko ba wa jipam la chade ni ne wat jet kachida ken kayuan te wi ai do wen kagalain ko an COVID-19 pet me war tago age oi wa yer.
Yes, not everyone has long-term effects, but many experience a month or more of fatigue, which is the most common long-lasting symptom. Other more serious long-term complications include shortness of breath and chronic lung disease, joint pains, and heart failure, and even sometimes change in brain function and thinking.
Ay, ette wale bene dai to gan per kagala ni per agani warwo chadorome rana talum mok enwat kay lukun tokdian. Ever chat kagala go ay do kdir enwat ikjelak imnang engineer. Matak in makwaj, matako agmajano in menono imugata in antarabal family akalanalajan.
So why is it our elders are more at risk than other age groups?
Edaga rutoro akalagoro what elab anchelet ergen roredik.
Because the infection-fighting parts of the body, called the immune system, don't work as well anymore and cannot fight off the coronavirus as well.
Kanare ano meron jibang pobaray en puenten nang nimi yamajer tino mo jano yung even evan meron jibang pobaray den coronavirus.
Why is it that someone with diabetes are also considered more at risk?
Yatagaya eleven kawadatangan yo chuan yo me yatangal.
Diabetes is a chronic disease that affects many different parts of the body, including the infection-fighting parts or the immune system. Diabetes weakens the immune system, so people with it can get sick with any type of infection more easily and more severely than people without diabetes. High glucose or sugar levels in the blood also weaken the immune system. So a person with diabetes and high glucose levels have a double whammy. They can get ill even more easily and more severely than people whose diabetes is in control. And we consider control a glucose level less than 160 or a hemoglobin A1C less than 7.
Nangin medyo tangal chuan nangin medyo me emajan tilat elang paden enpun. And what ano ko me jibang poparay enpun yo then elang kay nangin. Nangin medyo tangal emajan menakwe ano kain ran majano imkiya roelang tangali per yakam manapwen makajayar nangin me jan rome rajap tangal. Ngayalap kluko jak tangal yakam manan majano onako. Kia armedio me tangal im elap tangalio ipen ebirorongan nang mi teneo mi echap tangal tangalio echap ayugo yalabijen chubugi tijinongol ak aywan chiyawan ayugo jerep jenchinjoan.
That takes us to the next question. What do doctors do for patients with COVID-19 once they're admitted into the hospital?
Ito ko dengan kacit dengan cuan tayo tagadoro rekamani ngan renangin medio ewer COVID-19 iper iloan ay petaw.
Give them oxygen to breathe and laying people on their stomach and are putting them on a ventilator to help the weak lungs work. Giving medications by fluids in the veins to balance the immune system, like dexamethasone. Many get other medications through IVs too to treat complications from the virus. Other medicines may be antibiotics for secondary infections, antivirals, which are experimental yet, supplements and nourishments that they cannot take in by mouth while on a ventilator, and of course, medications for blood pressure, diabetes, or whatever other conditions a person has. The medications used for this are under investigation, and new ones may be used later on in this time. This virus is very serious, and sometimes the medications that we have don't always work. That is why sometimes, even with treatment, some patients will pass.
Pajalela katijin ngan menono. Kabero gear imlela mitinin ventilator ngan cibang ir berencarabal. Lela guno go iloren en wad guno in wego ngan cibang onogo. En wad guno in dexamethasone. Impar jad guno go ilo IV. Impar en wad guno go jad merecem merong iragi. En wad guno in onogo kap mangego imunon aipolat.
So if someone decides to treat themselves at home, what would you recommend for that?
Ang rinangin medyo chep kanan pero at pedal. Ewar ta nanin kakabila kala.
Stay home and isolated from other household members. Eat healthy foods, vegetables and fruits of all colors especially. Stay hydrated with low sugar fluids like water and herbal teas. Avoid sugary foods like cakes or sweetbreads, candy or sugared cereals or coffees with sweeteners. And take your usual medications, like for diabetes and high blood pressure. If you have diabetes, check your glucose levels at least once a day and call your doctor if it is over 200. If you have asthma, start or continue using your controller medicine and use albuterol every 4 to 6 hours for any cough. Do not use a nebulizer if you live with others who are not infected, as it would spread the virus more. Rest, but do move around in your isolation space to keep muscles of the legs, arms, and chest moving. Practice deep breathing every hour. Anything you touch or use should be kept separate from uninfected people, like put your dirty clothes in a bag and wait 3 days before giving them to someone to wash. If someone brings you food, wash your own dishes or advise them to wash them and wash their own hands after handling them.
Pero mayo imam im kotola gayok sentro mayo. Mga ko 11 year and what len wajage ko tenolap kain kalar. And em magajiga jam raga renoko me etchablap chukayer agaibo. Im rag naroko. Kachiyong mang im cham mga ko elap tangal and what cake, pilawe, donut, tangal, cereal, imra kobe peniko ngejep planta. Imra uno ko nimam alabaran. Ngan rotangan ro im ay elabay pelati per ngakwe rotangal enen ngaji kejam lale ak tiaga tangalewam. Ngayang legend rubuwi kole tagatayawam. Ngakwe juwarlak wanaman kajarabal unon kantorolo ko im aperol human emenangan tijinawa ngan pekojok jab kajarabal cidim in karre mejatoto ngan moko pene jadere nang me ngan rome recep nang kakije patap jabadal jen rumewa kaceng yang magadeget pemajal ko ilo nem pem imubom ran merongan enoror. And you could go amenono all about. Tabarod meneo quiti way. Kajanola general rectabnang me. May war ayanakan qual nuno quam, lelagan nuguno koam degot nuguno koam ngan chuan pe im katar chiluawa mananara mitio pugi yum kwali ngayawar yanay pogoto kijam kachiyang kwal kanoyawa moda janam lela im kakabileger peren kwal peyer mojin watayer kwal kanowa.
Okay, and the next question is, does the regular flu shot prevent COVID-19?
Ito ko tangan kachito kanay chuan. Unon tuloy anarong kay pabaray COVID-19.
It does not prevent COVID-19. It is recommended that everyone get the flu shot because it can protect against the flu, which is also a dangerous virus that kills many people every year. The flu vaccine is free at many places. At Health Point Auburn, we have free flu vaccines for the uninsured patients. So come on down.
Yawan tibang pabaray din COVID-19. Padap, tiday ko din pugunuin. Pwe, en tibang kay pwe, eden wad nang mitkain pakawatada, Olivia. Unuin elang chatigan kome ramarong letong ngan kay ilo e chalak wanen. Al point e chuan yan chicken takato kome rajaleto unuin ilo e chalak wanen ngan romi e chalakair insurance.
So given our number of cases and tragedies in the Pacific Islander community, what do you think our near future will look like if we don't take precautions?
Kanot panawani niya mo yan kwalok kan changan armid yang mo dayar chaguilo community na ta malamala kanidi yung chakalay ngan kem enwat amchep kajabarok.
It is unfortunate, but we know the Pacific Islander community has already been hit hard by this virus. As we have mentioned in other questions, this virus impacts people who are already sick and is spread very easily from person to person. It is important to continue to remain cautious and follow public health guidelines so the virus does not continue to spread in the Pacific Islander community at high rates. As much as able, people should wear masks and stay away from public places, especially if they are in a high-risk category.
Chalagilo kadamene, at chalaga community in Alaban kar chaladilo chenot nangin mijin. Enwat air karpa, arkarpa ilo kar kachidako malak, nangin mijin e jajere, chenio e nangin mij, nganar mij rome, rachab nangin mij. Alaban aurak kwechen, wana malak wotum, jojo kajabaroke imur kagiyenogo, emojlito wingan kay. Pwena nangin mijin, enche bajere manole kade ke chongan watar merong kajarwal me imche batalangan yen goralat en wat ke eben im parka watada.
We know it's hard, but if you must gather, avoid shaking hands or hugging people. Think about others at home who are at risk for COVID and how you don't want to bring it home to them. Stay 6 feet away when you gather and maintain social distance, as well as have some hand sanitizer handy. Remember, just because you see other people who are not following safety precautions does not mean that we should not follow the safety guidelines.
En wat emajat chale ke alaban pin akchit ayuin kachiong pwe ponchep Iripin aramid agada bogot aramid. Ilongam kaman wawinin, kwajala malakan romi, ebiro roer pagnang mit. Yung kalok ke kwachap kanan lelak nang midina nganir. Kami ni katola gayok chijino ne tolak cinaramid yo kwachper. Ipen ilo yeni koralap. Yung kemi mit yeni pag and sanitizer itam. Kemi mit boy echap melalin ke armi jero echat rachabalor kagien again kwen marong par chabalor kagien again.
Be creative with your family. Cook together in the home and experiment with traditional recipes in a healthier new way. Create new traditions, uniquely Pacific Islander that combine safety, healthy, and family. Sew or decorate masks with Pacific Islander images or words.
Ilom mayo kachang kamala malakome raman kain kamar pamali kuam. And what katagan ron kaniyok in mga in ailang kuar. Mga kome alabun ir ngan eman ngan edinur gainar. Komerong kakobay pamali ko chadam ilong am kuali ilong medin jarak FaceTime. Ang ngecep kaya met ngecep chinga met kan chinga ko armaka makiwat. Ngecep chiji jaban kanan kuar.
Thank you so much, Dr. Laurel, for answering all of our questions and informing the whole Marshallese community. We appreciate you so much.
You're welcome.
Pag nalalay na kayo ng kokoni loan poromi, yung joyo kaya baro kayo. Pwede nangan mijin, ejalaw di do tao na ganyan perye. Okay. Well, thank you.